Now, campaigners from the South East whose loved ones took their own lives at a young age have joined others in Westminster to have their petition discussed in Parliament. Among them was Hilary Grime from Cranbrook, who's calling on universities to be given a legal duty of care for their students. Her daughter Phoebe was 20 when she took her own life in student accommodation. The petition, started by bereaved parents, has been signed by almost 130,000 people and was debated by the Commons Petitions Committee.
We just want universities and the staff and everybody in them to do what's reasonable. And if they did that, we are sort of fairly sure that our children would be alive today and we wouldn't be here. And that's what we're wanting. And we're not asking them to be treated as children. We want them treated as adults, and we want the same treatment as you would as employment laws.
Well, also giving evidence to the Petitions Committee this afternoon was the mental health campaigner Ben West from Cranbrook, who went to school with Phoebe and whose brother Sam took his own life in 2017 when he was 15 years old. Ben, thanks for joining us this evening. What do you hope will be achieved by that session today?
Well, I think what the session today was about was gathering evidence. It's basically proving to government that there is an issue here, also proving to the government that actually this law doesn't exist, because from until today the government has basically said, no, it's okay, a duty of care law does exist with universities. Today we've managed to prove to government that actually, we've had a judge and a whole court case that has proved that that law does not exist. And today was about appealing to MPs and actually saying, this is the reason why a statutory duty of care needs to be implemented. We've given universities every opportunity to adopt guidance voluntarily, and they haven't. And now it's time for government to intervene and actually tell universities what it is they need to do. We talk a lot at the moment about best practice. It's not best practice, it's basic practice, and it should be statutory.
OK, the universities themselves aren't keen, are they? They say they're there to provide adult education first and foremost, and they're not a health service. So I guess the conversation is about persuading them, isn't it? Of
course, universities are an educational provider, and they're never going to be a health provider. That's not what this law is about. In the same way that an employer is not a healthcare provider, but they still have to follow strict policies when it comes to staff well-being. We're not asking for universities to become health providers or follow health provider guidelines. We're asking universities to think very carefully about how they interact with students and take reasonable steps to prevent them from getting worse in terms of their mental health, but take reasonable steps to look after their well-being. And that means investing in policies and having policies which show university staff how they're meant to interact with students. We know that a young person at university dies from suicide every 3 days at university. We're not asking universities to fix that. We're simply asking the government to mandate and statutorily require universities to be given tools and policies which help students and actually pass students on to the people that can help. We want, in the perfect scenario, is universities picking up early on warning signs and then passing them on to the NHS, on to people that can help. Universities are not there to treat. We absolutely know that, and they should never be there to treat medical illnesses, but they definitely are there to play a part in preventing suicide and preventing students from getting worse.
And briefly, Ben, you've explained what you're after. What happens next with your campaign after today's session?
It's a very good question. It's not really in my hands what happens next, but we've given everything we possibly can to these MPs. The next step is it goes to debate in the House of Commons, which is on the 5th of June. After that, well, we don't really know. We're not going away. We're going to keep the pressure on because we genuinely believe a statutory duty of care will save many hundreds of lives. But as far as after the debate, we're yet to see. There's lots of options we have, but the pressure is going to be kept on by us. OK, well, we'll all be watching with interest. Ben West, thanks ever so much for joining us this evening. And of course, if you've been affected by any of the issues we've just been discussing, you can find more support on the BBC's Action Line website, or you can call that number free of charge, which is on your screen now.